Well, welcome everyone to What Does Good Health Look Like? Raising the Standards of Occupational Health Performance Indicators. I'm Jane Whitelaw and I have the pleasure of introducing this session today. I'd like to start with a welcome to country. We acknowledge and pay respect to the past, present and future traditional custodians and elders of this nation, and the continuation of cultural, spiritual and educational practices of Aboriginal and Torres Strait Islander peoples. Occupational health metrics are an important component of OHS performance indicators. Recent articles on the increasing prevalence of silicosis and the resurgence of black lung have increased awareness of work-related health impacts. Yet, despite the critical impact of occupational illnesses and diseases, OHS reporting commonly focuses on workplace injury reduction and lagging health indicators, such as workers' compensation statistics that are inadequate in identifying the true extent of worker illness and disease. AIOH aims to identify a set of leading and lagging occupational health indicators that can support PCBUs to identify and track the workplace conditions and factors that can both adversely and positively impact worker health. We're aiming to develop a tool to benchmark Australia's occupational health performance and thus raise the standards for worker health protection. We'll also be using this webinar today to get an idea of what you think needs to be focused on in health risk management and what you think represents good practice. So thank you for joining us. I'd like to extend a very warm welcome to Counsellor Dr. Carmen Naylor. Carmen holds a degree in exercise science and rehabilitation, a master's in science research, a master's in occupational hygiene practice, and is currently leader of human health monitoring high reliability at ANSTO. In 2019, she was awarded the AIOH Drager Pacific Young Hygienist Award. She's a passionate advocate for OHS research, which was the incentive for completion of a PhD in the field of occupational hygiene and toxicology at the University of Wollongong in 2022. Her area of research addressed routes of exposure and health effects of metals. Carmen is also a sessional tutor at UOW, AIOH General Counsellor and active volunteer for the AIOH. She's a busy mother of two and enjoys encouraging aspiring scientists to pursue a career in occupational hygiene, the science behind worker health promotion. This session will be recorded and uploaded in the coming days, and we hope this is very interactive, and we encourage you to use the chat to respond to some questions and also put any related questions in the Q&A, and I'll do those at the end if we have time. So welcome, Carmen.
Thanks, Jane. And thank you to everyone who has taken the time out of their day to attend this presentation. I'm pretty certain I'm standing between you and the weekend, but I think this is an important issue, like Jane highlighted, but also it's a timely one around what does good worker health look like and raising the standard of occupational health performance indicators. So irrespective of the scale of a business or organisation, whether it's a small company or a large organisation, they're all bound by legislative requirements to protect the worker from occupational illness and disease. And occupational health metrics serve here as an invaluable tool to help businesses to actually measure their performance in the workplace. And I do feel as though I'm probably preaching to the converted here, as many in attendance today are occupational hygienists, exposure scientists. So you already understand if you don't measure it, you can't manage it. So by incorporating meaningful occupational health indicators into work health and safety reporting, we can actually help businesses, but also as health and safety professionals ourselves, we can help gain a clearer understanding of what are some of the key impacts in businesses that necessitate attention. Just muted. So the agenda of today's topic or webinar will explore a number of indicators. So we're going to look at leading indicators, lagging indicators that are largely designed to monitor impacts to worker health. These indicators have been identified through an AIOH working group, but it's not to suggest every KPI critical to monitoring worker health will be identified today, as we're also using this, like Jane touched on, as an opportunity to consult with you to get an idea of what you think needs to be focused on in the area of health risk management. So my goal today is really to help you or those in attendance to start to reflect on work health and safety reporting practices, and to provide some tips onto how we can make sure that there's occupational health and hygiene metrics developed into those reporting practices, so we can really start to ensure a balanced approach to health performance measurement within the workplace, and also to make sure high quality health indicators are well represented. So this presentation today is not a standalone topic. It is part of actually an AIOH strategic plan, which aims to achieve 5 strategic projects in 5 years, of which mine is the first off the rank. And in particular, this project is aiming to make visible what good worker health looks like. So on the screen here is the AIOH strategic plan. We released this last year in 2023, and it outlines on a page how the AIOH is aiming to achieve a healthy working environment for all. So I would encourage you to have a look at that. But highlighted here on the page is some specific project objectives linked to this strategic project. The AIOH Council has endorsed the early stages of this project, which is looking to examine occupational health indicators. And consequently, we're going to use this project to be able to help curate a system where we're going to crowdsource exposure data to be able to provide transparency on key health impacts to our workers. As I touched on, an AIOH working group has been formed, and we also sent out a recent EOI blast to our membership. And we're working with allied health and safety professionals, so occupational hygienists, occupational health practitioners, health and safety professionals as well. And they've been working together to highlight what are some key leading and lagging indicators, and also are present in part of today's session as well. So what we're trying to achieve here? So we know work health and safety performance indicators are important to really ensure an effective management system and to really contribute to organisation decision-making around risk mitigation. Yet, despite the critical impact of occupational illness and disease, we know a small minority of companies actually report on occupational health performance. And then when companies do report on occupational health performance, the lag indicators of occupational disease is often prioritised. So lagging indicators prioritising occupational health impacts, such as workers' compensation, is largely acknowledged as a less than adequate approach to measuring or identifying the true extent of worker illness and disease. And I think this is the most important concept. So it's due to that lag period between exposure to that health hazard, such as hazardous substance or noise, and the health impact. Because that health impact doesn't occur immediately, often that impact is perceived by businesses as being negligible, and therefore the impacts as well remain silent. So what that also means is those exposures are not being controlled as low as reasonably practical. And in addition to that, it's due to this lag period between the cause of the health impact that when the actual health impact or disease occurs, it's very difficult to be able to determine what was actually the cause. So what you should see here on the screen now is actually a slide making use of some lag indicators in relation to workplace fatalities, which you might be well familiar with. So it is well recognised in Australia that illness and disease potentially caused by work remains difficult to distinguish in official statistics. However, we know they're prevalent, and we know that some conditions such as black lung and silicosis are on the rise. And if we make use of Safe Work Australia estimates, they estimate 8 workers are 8 times more likely to die from a work-related illness than an injury. But we also know, for instance, over in the UK, it's estimated that nearly 12,000 workers are estimated to die per annum from a work-related illness. So we do question, is this difference between the UK and Australia accurate? And we know that there's definitely opportunity for improvement. So the most recent Safe Work Australia consultation paper on incident notification did recognise that the current reporting frameworks do not accommodate for injury or illnesses that develop over time. We know occupational diseases could be better tracked and reported, and this was also identified as part of a National Dust Disease Task Force, which made the recommendation to include the consideration for the establishment of a National Dust Disease Register. And just as in another example, data from the Australian Mesothelioma Register indicates in 2020, 701 people died from mesothelioma. And we know roughly 4,000 people die per year associated with an asbestos-related disease. So it's safe to say that many of these deaths are actually associated with occupational exposures. However, these deaths are not reported as such. A recent tool that was published from the World Health Organization on the occupational burden of disease tool helps provide current global estimates, and it helps, I guess, estimate countries and conduct illness rates in countries, but also you can identify health inequalities by different region, gender, or age group. But looking at the details from this application, we understand that exposures to silica, asbestos, diesel exhaust, ultraviolet radiation, exposure to long working hours, exposures to occupational particulate matter, gases and fumes are some of the most prevalent risk factors that have negative outcomes to workers. And this is just a specific example on examples of deaths attributable to silica from occupational exposure in 2016 from that tool. So this project isn't really going to resolve a lot of the issues or challenges or gaps around lag data. But for me, what this demonstrates is we have a really significant opportunity here to develop meaningful lead indicators that will provide a real-time measurement of occupational health performance. And ultimately, we can actually work towards prevention. So to improve occupational health performance, we need to help enable businesses to establish occupational health performance indicators to ensure a balanced approach to work health and safety reporting. And to help businesses do this, we will aim to promote a set of leading and lagging occupational health indicators that can support PCBUs to identify and track workplace conditions that can either positively or adversely affect worker health. And we're looking to take this work further by crowdsourcing that data to provide a de-identified dashboard. And I really do see this as a way to present data in a dashboard similar to a lot of the lagging dashboards available about injury occurrence. So from a preliminary review of the literature, it's quite clear to us that there's very few published examples of leading and lagging health metrics that could be used to monitor worker health. And by assisting better corporate health performance measurements, we can help businesses ensure compliance under work health and safety legislation. And they can do this by us providing a clear framework around leading and lagging indicators. We can help businesses identify and highlight work groups at significant risk to health. We can help businesses improve occupational health performance measurement. And we can focus on prevention through occupational health performance monitoring and ultimately as well evaluate changes in workplace occupational health risk. So this project aims to achieve this through 4 separate phases. The initial phase of the project is split up into a literature review, which we've already started to commence, where we're reaching out to fellow occupational health and safety experts to get their opinion on what good worker health looks like and starting to refine that list. We're into stage 2 now, which is a bit of interactive workshops to really through further networking and engagement with other health and safety professionals, we can get a refined list on strong leading and lagging indicators. And the next stage, we'll start to look at data collection using electronic tools and publishing the results. So what does good health look like? And I guess to do that, we to have an understanding of that, we need to have a clear understanding of what the definition is. So the World Health Organization Constitution states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So now, if we draw on this definition from an occupational health context, it's not just the absence of disease, but it's the promotion and the maintenance of the highest degree of physical, mental, and social well-being of all workers at work, at home, and also in retirement. So I did mention this research is a timely one. So in 2024, so only last month, an OH&S management document was published by ISO, which is ISO 45004. And this document complements ISO 45001 by providing performance evaluation approaches that align with that safety management system standard. And similar to the goals in ISO 45004, we will aim to assist workplaces in the selection of indicators based on different types of health hazards being chemical hazards, biological hazards, physical hazards, psychosocial hazards, and ergonomic hazards within the workplace. So out of all the slides today, I think this one is my favorite, not just because it's colorful, but it was adopted from the Health and Safety Executive. So this shows the spectrum of occupational health indicators that span from leading indicators such as health risk assessment, training, which includes things like training participation in health hazards such as asbestos, to lagging indicators, which include incident rates of illness and disease. So what we understand is that the understanding of occupational health indicators is fairly mixed, and particularly that's occurring in the leading part of the health spectrum. In the space of occupational health performance measurement, we understand that lagging metrics are often used to track when an illness, disease, or exposure has occurred. And if there's kind of one point that you can take from today's session, it's not in the space of occupational health, it's really important that there's not an overemphasis on lagging indicators, as this actually doesn't accurately reflect current occupational health performance. And that's again due to that lag period between exposure and the actual health impact. So when developing or setting occupational health performance metrics, like all goals or measurements, they should be SMART. So they need to be specific, measurable, achievable, relevant, and time-bound. But also it should involve monitoring data that's going to positively impact worker health, or provide information on health impacts that are going to be critical to the PCBU so they can better anticipate, evaluate, and control those health risks. There is plenty of sources of information in regards to the development of occupational health performance indicators, and some of these performance evaluation sources are included on this slide, and in particular can include things like our exposure assessment data, occupational health and surveillance data, injury and illness tracking, workplace surveys, investigations, outcomes from focus groups, and risk assessments. So I think you've probably already picked up on that I've referred to lagging and leading indicators. So there's broadly two different groups of indicators, which either fall into that broad category of either a lead or lagging indicator. And although I've said it's important that we don't overemphasize leading indicators, both lagging and leading indicators do serve a purpose for monitoring if critical controls are in place and can be used to monitor occupational health performance. These indicators can be quantitative. So for instance, using health and exposure monitoring data, or it can be qualitative indicators, such as simply ascertaining people's opinions regarding their exposures or the effectiveness of controls in the workplace. So before we go a bit further, we're going to start looking at the definition of leading and lagging indicators to ensure we've got a common understanding. And we're going to start with the most focused or the most commonly used indicator, which is a lagging indicator. So lagging indicators relate to past. So lagging indicators relate to past events, and they measure things that have already happened. So they form essentially part of reactive monitoring and are generally quite retrospective in nature. Lagging indicators, like I've already touched on, are the most common OH&S tool to measure health and safety in the workplace. And in the health and safety space, lagging indicators are often used to track when an illness, disease, or exposure has occurred. So an exposure to, for instance, hazardous substance noise. So we did want this session to be quite an interactive session. So we're going to start a poll shortly, and we would like to know, does your industry utilise lagging health performance indicators? And that should pop up there. And we are going to hope to utilise the chat during this session as well. So hopefully...
Yes, our poll is underway, Carmen. I can see some answers coming in now. Oh, heaps of people. We've got lots of yeses up there on the screen, about the 80-20 to yes and no. So that's very interesting. Lots and lots of workplaces out there using lagging health performance indicators.
Yeah, which I think it is quite anticipated. So we did anticipate lagging indicators are the most commonly used tool. And from what kind of is appearing on the screen, over 80% of people in attendance are familiar with their industry using lagging indicators to monitor health and safety performance. We did want to utilise as well the chat today as well. So in the chat bar, if you're able to provide some commentary around what are some lagging health indicators that you're familiar with, Jane will also mention those for further discussion.
I will. Thanks, Carmen. I think we're pretty steady at the 80-20 now, so we might close that poll.
And anything appearing in the chat, Jane, around some examples that people are familiar with?
There's a few people are saying they look at both leading and lagging, but on lagging, things like hearing loss, abnormal biological monitoring results, occupational illness.
Which are some good examples there.
And Mark Solomons has put one here, TRIFR. We all love that. You might want to expand on that a bit, Mark. I've only had one coffee today. Excellent. We'll keep popping those in the chat as Carmen moves on. That'd be great. Thank you.
Excellent. Yeah, we are going to look at a lot of this chat data after the session today, so we can take any lessons learned back with us. So the next few slides I'm actually going to present are some of the lagging indicators we've identified as part of the literature review. So these indicators that we've identified, I've split up into subcategories which align with that ISO 45004 standards. So it considers, yes, the different types of health hazards in the workplace, but also different levels of OH&S functions. And as I've only got an hour today, I'm not going to talk to every single indicator, but I have highlighted some indicators for further discussion. So actually the one I've got highlighted here is a category around occupational exposures, and also something that I think is quite topical. So, and we know that a lot of workplaces have a lot of data on. So under work health and safety laws, we know organisations are required to keep a chemical register, and some of these systems are very advanced in that we can quickly ascertain out of the hundreds or thousands of chemicals in a stock holding which of those chemical hazards are going to pose the highest risk to health. So this example lagging indicator is around the number of chemical substance of very high concern. So therefore, a simple measure of the number of chemicals of very high concern in the register, such as, your carcinogenic, mutagenic, reproductive hazards in a chemical stock holding, is important information for a business, as it allows them to be able to prioritise those hazards either for elimination or to ensure that those hazards are controlled as much as reasonably practical. Another example lagging indicator I've got flagged here is around the assessment of risk, which is where it also touches on exposure to aerosols. and the use of exposure monitoring data, which I guess is our bread and butter in the field of occupational hygiene. So exposure monitoring data, yes, it can be used to detect adverse exposures to toxic chemicals such as hazardous gas, vapors, or disease-causing dusts. And these exposure monitoring results, when compared to a legal limit or an action level, which is often 50% of the exposure standard, can either confirm the nature of the exposures within the workplace, but also confirm health monitoring requirements, as well as the need for further control measures in the workplace. And ideally, if this lagging indicator was established within the workplace, it provides a bit of a short-term verification whether those controls are working. And ideally, you would be seeing a trend in decreasing rate of adverse exposures following implementation of controls. This slide here describes a lag indicator, or it describes a number of lag indicators around health surveillance. But the one I've got flagged in particular is around a lag indicator for occupational noise exposures, which is the number of audiometric results with threshold shifts on their annual, with significant threshold shifts on their annual hearing tests. So we all know that workers who are exposed above the exposure standard for the 8-hour shift required to be on an audiometric program. And the good thing is the Australian standard AS 1269.4 actually defines what a significant threshold shift is. So I would be asking those in attendance today, with your audiometry that's being conducted annually, are you using that information around significant threshold shifts to actually look at control actions? And the good thing is, in the Australian standard AS 1269.4, that actually provides you control actions. So where you've got workers who are showing results as part of their annual hearing tests associated with significant threshold shifts, you can review their job tasks, confirm that they're using their hearing protection devices accurately, and also look at if they've got other exposures such as exposure to ototoxic substances. So this slide here shows lag indicators regarding injury and illness data, which we've already talked a bit to in today's session. And also I've flagged here an indicator or a lag indicator around corrective actions, which in particular relates to asbestos and hazardous materials. So as I touched on earlier, asbestos really is the biggest killer associated with occupational exposures within the workplace. So ideally, all workplaces should be having a metric around how quickly we're either prioritising those hazards for elimination. So this lagging indicator is around the number of hazards abated on the same day, week or month that hazard was identified, and really demonstrates the efficiency that the business is taking to either eliminate or control those health risks. Other example lag indicators could be around management of change as well. And what we might move into now is to discuss further some leading health metrics. So I think I have touched on that. We did state that data on high quality leading health performance indicators around health were scarce. And often when we did find indicators, we did identify a lot of them in the literature focused on lower order controls like personal protective equipment. However, it was exciting to see that some industries like oil and gas have started to develop performance indicators in the health space. And in particular, in 2020, the American Industrial Hygiene Association actually provided a best practice guide for leading health metrics to help support businesses in making workplace decisions or help support workplaces develop metrics around health performance. So although we know that health indicators are less commonly measured and understood in workplaces, it was great to see that there's more discussion occurring on this topic. So as leading indicators support health management and I guess are getting a little bit more of attention in the literature, I did want to go back to the polls and get an idea of, does your industry use leading indicators to measure specifically health performance? And again, in the chat, if you can pop some examples that your organisation has used. So I think that poll has started up now, Jane.
Yes, we're going on the poll, and thank you everyone for jumping in really quickly. That's nice to see. We're looking at just over 50% of people saying yes, they're using leading health performance indicators. A little bit lower than the ratio for the lagging. It seems a lot more people are using lagging indicators. So we're sitting at, they're around 60-40 yes to people using leading health performance indicators. And just waiting to see you pop some examples of that in the chat. Share that with everybody, what leading health performance indicators you're using.
And I think we did anticipate a similar response around leading indicators. We particularly know lagging indicators are more commonly used. And I guess the other part that I think influences the results here is there's a lot of hygienists and exposure scientists who already do a lot of measurement of occupational health data. But yeah, we'll look to, I guess, share those results with you now. Any comments in the chat, Jane?
Yeah, that's right. I think there's a lot of people saying things like health surveillance and, looking at the hazmats and reducing the areas of highest concern, statistical analysis and looking at critical controls for high risks and scoring them, effectively using engineering controls. So yeah, they're the main things that are popping up. Things like number of health risk assessments completed versus planned, which is a great one. I know that we've discussed recently, Carmen. So let people just continue to pop that in the chat. I'll stop the poll and throw back to you, Carmen.
Thanks, Jane. So thank you for providing those examples. And I guess to ensure a common definition again, I guess different to a lagging indicator, a leading indicator is prospective. So it can be a predictor of future health and safety performance. And yeah, as I touched on, there is increasing recognition of the value of leading indicators in that it can be preventative and provide an early warning that something may be wrong within the organisation as well. So this is another diagram I quite like. What we're thinking is a lot of the shift towards leading indicators in work health safety performance metrics is perhaps driven by an increased understanding or focus on organisational and human factors in the lead up to an outcome. So this is a diagram from the International Council on Mining and Metals on this slide. And it kind of demonstrates, rather than just focusing on an undesired or desired outcome, if established effectively, occupational health leading indicators might either refer to root causes of a health impact, whether they're and potentially distant causes, and which all align with the safety management system as well. So what I'll start to do is list some indicators that we've identified as part of this working group, and again, talk to some of the indicators that we've highlighted. This indicator here is around top management commitment and uses qualitative information and draws conclusion around a whole organisation approach to health risk management. So whether aggregate results of exposure assessment or occupational health surveillance data is actually presented to upper management on a regular basis. And again, if you need resources in terms of exposure control plans, it's important to make sure that that information is getting up to top level management so that resources can be dedicated to mitigating those health risks within the workplace. Sorry, Zoom is playing up on me. There we go. All right, so this is another indicator around planning actions and might be a bit of value and I guess take on board some lessons learned potentially from COVID-19. So this is an indicator around the number of drills and assessments of readiness for pandemic plans. So by monitoring those planning actions before the event actually occurs is a valuable indicator, as it will ensure that, for instance, pandemic response plans and resources are adequate if and when that event occurs. Leading indicators that measure and analyse safety management system performance, such as the provision of training and information to workers, is also another valuable health metric. So the example here highlights the provision of stress management education to workers. And we all know that there has been recent change in psychosocial legislation to make sure that that hazard is effectively managed. And having a metric like this also ensures that adequate support and resources are being supplied to workers around this hazard within the workplace. Leading indicators can be established to monitor compliance to legal and other compliance requirements across an organisation, and also can be around, assessment of risk, in particular in the health risk assessment space. And I think Jane called out a few of those in the chat before. So by monitoring the percentage of updated health risk assessments that due to potential exposures, chemical, biological, physical agents, we can monitor, the completion of health risk assessments, and also if those health risk assessments are being regularly reviewed and updated, it means that those the focus on those control measures and minimising exposures to their health hazards within the workplace will be prioritised. Leading indicators can also look at health surveillance and in particular also, uptake of those programs across campus as well. So as an example here, I've flagged the indicators of the fulfilment of a health monitoring program, which is the number or percentage of vaccinations, particularly with the winter season popping up. This would be not only a good program to offer workers, but also try and look at the amount of coverage among workers that these programs deliver as well. And the importance of monitoring things like degree in workers' participation means that potential strategies can be implemented to increase participation in the next campaign. Leading indicators, importantly, can also be used to verify effectiveness of critical controls, which I am quite passionate about. And as an example here, we're flagged on the screen indicator around ventilation systems. For example, an indicator around the percentage of ventilation systems that actually achieve acceptable flow rates. And obviously why this is important is we want to ensure that those controls in the workplace are verified as working effectively. So as part of this research, we are looking to tailor a questionnaire to identify where people or workplaces are sitting at in Australia regarding leading health indicators. So what we would like to get is your say on what actually you think is a strong leading health indicator. So I'd like to, for everyone in attendance, to start to do some brainstorming, if you have not already, around what you actually think is a strong leading health metric. So here is just an example of what I think is a strong health indicator, which is related to the prioritisation of hazards that present a severe health risk. So I think I mentioned earlier, often chemical registers have, for instance, high health impact hazards in stock holdings. So a good leading indicator that looked actually at the implementation of higher order control measures would be important to ensure that the business is using the most effective control measures to minimise worker exposure. So the health indicator on the screen here is listed as the percentage of severe or extreme health hazards that have established controls in the hierarchy of control greater than level 3. So what that means is the business using elimination, substitution or engineering control measures to minimise health risks. And I think we've talked a lot about indicators, but for each type of indicator or metric, you really should be also thinking about a KPI. So what point in which you deviate from this KPI should also be flagged for attention. So often, for instance, an indicator like I've got on the screen here, the tolerance may be set at 100% completion for that action. But alternatively, for other types of metrics, you may agree of a level of acceptable deviation from that KPI. And I think when we're reporting about how we're, meeting a KPI, simple is often always best. So whether it's something like a smiley face or a sad face, if you're not meeting that KPI, and often those common traffic light symbols of like green, we're at 100% completion, amber, not meeting it, and red, not in compliance. And I think I also discussed before, when establishing leading indicators, we should be trying to create indicators that are around both a specific health hazard or an outcome, and think about, I guess, those critical risk control systems. So what I've listed here on the screen is the hazards associated with welding fume, which we know recently there's been some changes around the workplace exposure standard for. What we should be doing is re-reviewing what control systems we have in place for that hazard across organisations. So I've just simply listed some control measures for welding fume that we could consider, things like eliminating the need to cut, on-tool extraction, use of local exhaust ventilation, obviously operational procedures, and also things like correct and access to respiratory protective equipment. So when establishing leading indicators, you should be considering what indicators you could set up for some of those control systems that you have in place. So if we look at local exhaust ventilation, a leading indicator for that would be the number of LEV systems that perform correctly when inspected or tested. And I guess when we talk about leading and lagging, you can have a leading and lagging indicator for each risk control system. So for local exhaust ventilation, a lagging indicator could even be the number of LEV system indicators that are working below the desired standard. When trying to develop leading indicators, there's a number of resources that you can go to, and I would always encourage things like going to the Bible, which are your Principles of Occupational Health and Hygiene, which does in each of its chapter list risk control strategies for each health hazard in the workplace. Obviously, there's AIOH position papers, codes of practice, Australian standard, and other evidence-based resources could be referred to when developing those metrics. So hopefully you've had a bit of an opportunity to, I guess, reflect and brainstorm on different types of leading and lagging indicators available, and also had an idea of what is a good, strong health metric. And I guess, like I did say, we want to work with you together to identify what are good examples of leading health indicators. So feel free to either complete the survey by clicking on this QR code, which will take you to a survey, or alternatively take a screenshot of this QR code, and when you do have some time, complete that code, because I would like to know, what do you think good worker health looks like? So I think we know that leading indicators are less commonly used in businesses, and as such, there must be some challenges or barriers around the implementation of these types of metrics within the workplace. So again, using the chat bar, I would like to get an understanding of what you actually think are some of the barriers to establishing health performance metrics in the workplace.
They've been very active on the chat, Carmen. There's lots of good information coming in, which is very exciting, because we really do want to consult widely on this. It's not just driven by a central group, and we will be also consulting widely with allied health professionals and other professional organisations. So we will get the QR code back up on socials and out to you. So feel free to share that around as well, because we really, really want to get a broad range of opinion on that. So looking at the barriers to establishing health performance metrics, and Yeah, it's not always easy, is it, when it's many, many years between the exposure, often many years between the point of exposure and the disease outcome. So some of the things that are coming through are lack of understanding and competing for resources. Occupational disease takes a long time, management moves on, you lose that corporate memory. One of the things that, they're coming in very quickly. And Peter's made a very good point that a lot of workers are employed in small to medium-sized businesses where perhaps the business owners are just not aware of the hazards and also perhaps don't have the finances or don't allocate the finances for worker protection. And they're more likely to have moved on and be transient workers as well. So yes, that focus on what's important now and that long latency period. The safety is often considered more important because it's immediate and very present. So there's some great answers there. Thank you.
Yeah, thanks everyone. And I think, yeah, you kind of hit the nail on the head. I did have a bit of a brainstorm as to why we do see some, I guess, less use of leading health metrics within the workplace. And yeah, you've touched on some of those. So I think some challenges related to the selection and maintenance of health performance indicators could be lack of engagement as well from the workers. They may not actually perceive that these are important, like metrics or hazards to monitor within the workplace. I have to kind of put my hand up around this as well, in that when establishing indicators, that those indicators might be too complex. And I think earlier there was reference to the use of statistics, and often, particularly when providing a lot of data, particularly using a lot of statistics, there's potential for misinterpretation there, particularly when reporting that across the business. So in addition, it may be easier as well, and I think we heard people saying around those hazards that occur more frequently are often measured, but those events that occur less frequently but are certainly serious and have those long-term health impacts are often more, I guess, overlooked. So we do need to, as part of this project as well, start to think about how we can overcome this. And I do think it is critical for us to start engaging with workers, management in the development of these indicators, which I hope everyone today can reflect on and can start to work towards. So those work groups can actually help propose areas for improvement as well. And what I did touch on before, you do need kind of top management support to make sure the resources are available for you to be able to monitor that information, and then also, I guess, implement measures to reduce those control measures when you identify the hazard. You need to be thinking about simplifying metrics where possible and to ensure clear communication to prevent misinterpretation. And I guess that's where the kind of smiley face, sad face, traffic light symbols kind of come into play. And leading health indicators should really be established to minimise health impacts of health hazards that are a significant risk to health. So I think that summarises up a lot of the messages for today's session. And overall, just to finish, effective management of health hazards in the workplace does require a proactive approach. And I think that's where these leading indicators really come into play. We do recommend a balanced approach to the management of health and safety in the workplace. So work health and safety reporting should really include occupational health and hygiene performance indicators, as well as those traditional safety performance indicators. And I do believe occupational hygiene is a discipline that's best managed together with occupational health and wellbeing as a holistic approach. It's also a bit of a nod towards that total worker health. So ensure, as well as your hygiene metrics, that there's metrics around your health and medical health surveillance programs and wellbeing programs as well, to ensure that is being holistically managed. And also, if you remember that definition about what health is. And last but not least, leading and lagging indicators, it is that they should coexist, but for health, there should not be an overemphasis on those past or lagging indicators, as those good quality leading indicators will ultimately be more effective in helping reduce or eliminate those seriously adverse health outcomes for our workers. And I guess, like my favourite podcast, I do kind of want to conclude with a bit of a quote, which is, not everything that counts can be counted, and not everything that can be counted counts. So I think I take from this is, if a health outcome matters, we really should be, and is really meaningful, we should be trying to invest as much resources in to understand it and improve on it. So thank you for attendance in today's session. I was able to keep that just under the hour. Obviously, we've obtained and looked at a lot of literature as part of this working group. So I have included some key references from which we've kind of looked at today. We are looking to kind of obviously publish more information as it comes to light as part of this project. And I guess if you do have any question and answers, I think we have some time to do that as well, Jane.
Yeah, that's great. Thank you, Carmen, and thank you so much for taking us through this. I think it's a really exciting project for AIOH to be developing the leading OH metrics. One of the messages that I really liked in your key messages was about leading and lagging indicators coexisting. And I think a great example known to most of us would be looking at noise exposure and taking temporary threshold shifts, say, as your leading indicator rather than noise-induced hearing loss as a lagging. Of course, we do need to measure both, but put more emphasis on the leading side. So thank you for that. Yeah, people are putting some great comments in there. We do have a couple of questions. And you mentioned, Carmen, around the definition of good health. And there's a question here from Dion around leading indicators. So what is the general interpretation of a leading indicator? So what are we trying to do with that? Is it to prevent the exposure, overexposure, manifestation of risk, or is it all of those things? And I think that's a great question, and thank you for going back. I think it's really important for us to go back to what are we trying to achieve, and we're really looking at protecting worker health and, you know, sending whole of life health for our workers, and sending them home even better than they came to work. So I'll let you talk to this point. Thanks, Carmen.
Yeah, if I could just bring you back to my favourite slide. Like I said, why I really liked this slide that was adapted from the Health and Safety Executive was it kind of didn't just pinpoint something as lagging and leading. It's obviously, I guess, a journey between that final health outcome and, I guess, the exposure to a health hazard. So I think the way I take it in and around leading indicators and a framework of leading indicators, that there is a lot of things that we can do before an exposure occurs within the workplace, and that it really does come down to the effective risk assessment and implementation of controls before those exposures occur. Obviously, in the workplace, we're already dealing with something already being often introduced and trying to provide control advice as well. And that's why I really liked this kind of spectrum, because before the disease or illness does occur, there's other things in that spectrum that we can do before it results in an actual, say, compensatable claim or disease. There's things like that. And this is why all these factors across the health management system are all very important around things like identification of the hazard through and risk assessment of that hazard in your occupational health management system, making sure you've got a lot of safety management system processes in place to ensure critical controls are put in place. And then things like the verification that those occupational health risk controls are put in place for those certain hazards. And then you've got things like your exposure monitoring and your health surveillance, which are really monitoring the effectiveness of those hazards as well. So I think hopefully that kind of touches on it, that yeah, there's a broad range of indicators, and yeah, I think all of them definitely do have value, and certainly ensuring that we also have accurate register of diseases that are occurring in the workplace is an important issue and something that is being prioritised and also looked at. But I guess for the scope of this project, it's trying to find some of those indicators, that we can put in place to help businesses monitor their performance so those illnesses or disease don't occur.
Thank you. Thanks, Carmen. We do have a couple of questions around what leading metrics you might be using or we might be using. And I know that as a working group, we have a massive spreadsheet of a whole heap of leading and lagging indicators, and we've touched on some of those today. A point that, thank you, Janine, for jumping in with some great information, a quote that I really like that says that they talk about work enhancing health rather than hindering health over the working lifetime. So I think that's a really neat thing, that we're not just about protecting worker health, but we really want to have good workplaces with, you know, great controls, and that what we're doing is actually enhancing workers' health rather than just the protection side.
Yeah, and I think that's where it definitely the discussions around total worker health. I think that quote really hits home. There's no point really trying to reduce people's by, for instance, implementing programs in the workplace where you're trying to reduce skin exposures to the sun, and we're doing skin cancer health checks, for instance, but then not trying to minimize actual exposures to occupational carcinogens in the workplace. So I think it does need to be a holistic look at what are all the activities that you're doing to try and really benefit worker health overall. And yeah, you might have a really robust program in place for, say, asbestos awareness to ensure people know what all the control measures are around that, but you may not have a focus around reducing, like, for instance, smoking within the workplace, which we know has a relationship around the severity of, illness rates for asbestosis. So I think that's where, with all your these types of indicators, it should definitely be holistic in nature and, include health and safety indicators as well.
Absolutely. Well, thank you so much for that, Carmen, and thank you everyone for joining us today. We've had a really large group online, and this engaging webinar will be posted up as soon as possible. And we really, really look forward to getting the results of the OH Metrics survey. So Kelly's popped that in the chat. So if you haven't taken a snap of that QR code, download that, and that'll stay on your phone. You can fill that in later. Take a moment to fill it in now, or fill it in at your leisure. We will leave the survey open for some time. So if you're not watching live today and you are then, subsequently watching this online in the future, please feel free to engage in the survey and give us some feedback. As Carmen's pointed out, this is a 4-stage project, and we'll take a period of time. We're in stage 2, which is really the consultation stage. So thank you everyone for joining in today, and thanks again, Carmen.
Thank you, Jane. Thank you, everyone.